Follicle-stimulating hormone, or we call as FSH, is a gonadotropic hormone that produced in the body by the anterior pituitary glands that stimulates the growth of follicles in the ovary and induce the formation of sperms in the testes. FSH was synthesized and secreted by gonadotropes of the anterior pituitary gland that controlled by pulses of gonadotropin-releasing hormone GnRH. FSH regulates the development, growth, pubertal maturations, and reproductive process of the human body. In both male and females, FSH stimulates the maturation of the germ cells. In females, FSH stimulates the growth and recruitment of immature ovarian follicles in the ovary, cause ovulations. In the yearly follicles, FSH is the major survival factor that rescues the follicles from apoptosis. Apoptosis is programmed death of the somatic cells of the follicles and oocyte. In the luteal phase, the level of progesterone and estrogen decrease and no longer suppress the release of FSH. Consequently, FSH peaks at about day 3. Day 1 is the first day of menstrual flow. When the follicle matures and reaches 8 to 10 mm in diameter, it starts to secrete significant amounts of estrogens. The increased estrogen levels cause the decrease in FSH production by inhibiting GnRH or gonadotropin-releasing hormone production in the hypothalamus. The decrease in FSH levels causes the smaller follicles in the current cohort to undergo atrophy as they lack sufficient sensitivity to FSH to survive. In males, FSH stimulates the maturation of seminiferous tubules and spermatogenesis. FSH enhances the production of androgen binding protein by the Sertoli cells of the testes by binding to FSH receptors on their basolateral membranes and is critical for the initiation of spermatogenesis. The importance of follicle-stimulating hormone in the woman, FSH helps to control the menstrual cycle and the production of eggs by the ovaries, while in the male, FSH helps control the production of sperm. Besides that, the amounts of FSH was measured in both a man and a woman to determine why the couple become infertility. The FSH level can help determine whether male or female sex organs are functioning properly. If high FSH levels occurs during the reproductive process, it is abnormal. The diseases that we produce are premature ovarian failure, premature ovarian aging, Turner syndrome, and testicular failure. Low FSH levels. This condition is typically manifested in males as failure in production of normal numbers of sperms. In females, the failure in reproductive cycles is commonly observed. The diseases that we produce are polycystic ovarian syndrome, Kallmann syndrome, hypothalamic suppression, hyperprolactinemia, and gonadotropin deficiency.